taking care of patients after heart attack is equally important during the heart attack. Let me tell you how to deal with the patients. Myself, I am Dr. Ranga Reddy, consultant interventional cardiologist, Apollo Jubilee Hills, Hyderabad. So a patient who had a heart attack, so initially when they are in the hospital, they'll be undergoing interventions, medical management, they'll be in ICU, post-ICU care, injectables, oral medications. All these things will be taken care by the nursing and the doctors in the hospital. So after discharging, after the patient gets discharged, so mainly we need to focus on the medications where the doctor prescribed in the prescription and day-to-day activities. Once the patient had a heart attack, generally heart needs rest for some time. After heart attack, after the patient gets discharged from the hospital, we need to take care, see the patient closely, observe them and see if the patient is complaining of any symptoms or whether the patient is compliant with medications. We need to monitor them regularly. Heart needs rest after the attack. It means like if there is a less blood supply to the heart, it will take some time to recovery. 4 to 6 weeks is the ideal time where a patient with an acute heart attack post recovery, we say to take rest for 4 to 6 weeks. That's very important. That plays a very important role for the heart to improve, to have a healthy and quality lifestyle. So closely monitor the patients, take good care of the healthy diet. The diet chart will be given to you from the hospital. Take care of the diet and medications which was prescribed in the prescription. You should take it regularly. Mainly the antiplatelets, blood thinners and the other medications are very important for post heart attack patients. Ask the patient whether they are feeling comfortable, whether they have any chest pain, any breathing difficulty, any palpitations, sweating, nauseating feeling. So closely monitor the BP. If the patient is diabetic, monitor the sugars. If the patient is having any other added any infections or any other symptoms, please consult the doctor immediately. Don't neglect any symptoms immediately after the heart attack. So chances of having a re-attack within 4 to 6 weeks is 1%. So within that period, you need to closely monitor the patient and regularly consult the doctor and take basic ECG and basic 2D echo to monitor the heart health. So coming to the caretakers, the patients who gone through the heart attack after discharge, they need to be careful with their diet. They need to be watching themselves for symptoms. They have to do their regular routine basic work like going to the washroom, walking in the house for at least like 2 to 3 minutes. Look for any symptoms, any exertional symptoms, any palpitations, sweatings. They need to check their heart rate and BP regularly. If the patient who had a massive heart attack with less functioning of the heart, they need to watch for oxygen saturation, BP fluctuation, the amount of salt intake and the amount of fluid intake. This also plays a very important role in the day-to-day life of any post-cardiac patient. So when the patient is having giddiness or breathing difficulty or chest pain or any other major symptoms, please consult your doctor and see that the patient doesn't have any complications of the heart attack.